Hi, I'm Jane Baraz, and I'll be discussing cranial nerve 5, the trigeminal nerve. The trigeminal nerve has widely distributed sensory and motor functions in the head and the face. Located on the pons, the trigeminal nerve consists of 3 branches: the ophthalmic, the mandibular, and the maxillary. So touch, pain, temperature information from these regions is relayed through 3 sensory and 1 motor nuclei. The main sensory nucleus receives information about touch, muscle movement and position, while the spinal trigeminal nucleus receives information about pain and temperature sensations. The mesencephalic nucleus receives information about the jaw and the teeth. The motor nucleus controls the muscles of mastication or chewing, so that's the masseter, temporalis, and the medial and lateral pterygoids. The ophthalmic nerve is responsible for sensory innervation of the upper face and the scalp. It also contains sympathetic nerve fibers, which are responsible for pupil dilation, and it supplies the ciliary body, iris, lacrimal gland, conjunctiva, and the cornea. And you'll see a corneal reflex test later in this video. The branch also supplies superior portion of the nasal cavity and the frontal sinus. The maxillary nerve, which is also a sensory branch, supplies the area just below the orbits and above the mouth. This branch carries sensory input, including pain information from the upper teeth and upper gums, the soft and hard palate, and the mucosal membrane. The mandibular nerve is the only branch of the trigeminal nerve that has both sensory and motor components. This division supplies sensory innervations to the anterior 2/3 of the tongue, not taste. That's what the 7th cranial nerve, the facial nerve, is responsible for. The lower gum, lower lip, mouth, the buccal mucosa, the anterior part of the pinna, and the external auditory meatus and external surface of the tympanic membrane. The motor component of the trigeminal nerve innervates muscles of chewing, again, the temporalis, masseter, medial, and lateral pterygoids, as well as the tensor tympani, which is a muscle in the middle ear, which helps dampen loud noises. And the tempor veli palatini, which is a muscle that helps prevent food from entering the nasopharynx and opens the eustachian tube, connecting it to the throat, connecting the throat with the middle ear, and that helps equalize pressure. Damage to the trigeminal nerve can cause varying effects such as decreased sensation, increased pain, weakening, paralysis of muscles of chewing. One notable condition caused by disruption in trigeminal function is called trigeminal neuralgia, which is characterized by episodes of severe shooting pain in the face, and that can be caused by brain lesions, surgical injuries, stroke, or other types of facial trauma. Both the sensory and the motor components of this nerve are important for SLPs to be aware of, given its importance in feeding, biting, and chewing and swallowing. Having a working knowledge of what's involved in this nerve's function helps the clinician properly conduct an assessment and make an informed decision about how to approach any issues that may arise. And next up, you'll see an exam of the trigeminal nerve. Hi there. Today I'm going to be testing the trigeminal nerve function. First, I'm going to test the sensory function of the ophthalmic, maxillary, and mandibular areas innervated by the trigeminal nerve. First, I'm going to use this cotton ball to test sensation in these 3 regions. So I'm going to ask my client to close his eyes and say yes when he feels the sensation.
Yes. Yes. Yes.
Good.
Yes. Yes. Yes.
Great. Now I'm going to repeat this bilaterally again, the sharp end. Close your eyes.
Yes. 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 Yes.
So here I'm looking for equal sensation on both sides. Do you have that?
Yes.
Okay, great. Now I'm going to ask you to differentiate between soft and sharp sensations in these regions. So close your eyes once more.
Sharp. Sharp. Soft. Soft. Sharp. Sharp. Soft.
Good. Now I'm going to test your corneal reflex. The corneal reflex is caused by a loop between your trigeminal sensory nerves and your facial motor nerve. So I'm going to ask you to look up, and I'm just going to hold the bottom part of your eyelid open, and I'm looking for blinking on both sides here. Very good, thank you. Finally, I'm going to test motor function in the mandibular region. So I'm going to ask you to bite down for me, and I'm going to feel the strength of the temporal and masseter nerve. And I'm also looking for equal feeling on both sides. Okay, equal feeling. Now bite down. I'm looking for two even sort of balls here, and that's testing the strength of the masseter muscles. Okay. And finally, I'm going to test the pterygoid muscles. So I'm going to ask you to open your mouth, and I'm going to ask you to resist my closing. So here we go. And here, I'm also looking for any sort of weakness or deviation. That looks nice and strong. And that concludes our test of the trigeminal nerve. Thank you.